Hello, welcome to the Ocean County Library Lacey branch. My name is Chris, and I'm honored for you to be joining us today virtually for our program called Maternal Mental Health Awareness. Joining us today to present on this topic of maternal mental health is Pat Vena, licensed clinical social worker from the Central Jersey Family Health Consortium. Pat will be discussing postpartum depression and other prenatal mood and anxiety disorders during her presentation. We thank Pat and Central Jersey Family Health Consortium for presenting this important and valuable topic today to our Ocean County Library patrons. And with that, we shall begin our program. So give me a few moments while I'll share my screen and we will begin our presentation.
Okay, thank you for that wonderful introduction. And it's a pleasure to be here today, without a doubt. And I feel the same way. This is such an important topic for us to learn about, no doubt. And I'm going to call it Perinatal Mood Disorders, Recognizing and Resources. And our take-home points today are, next. Okay, yep, that's okay. All right, our take-home points today are perinatal mood and anxiety disorders are now being called PMADs. And that's because when we called it or referred to this as just postpartum depression, it didn't take everything in. So the movement now is that we are calling it PMADs, and it encompasses everything. And we know that PMADs does not discriminate. Anyone can get a PMAD. Anyone, and we're seeing that dads also are experiencing postpartum depression. They are disruptive, they disrupt the household, and they disrupt the our early time with our infant. Their care and growth are so important, and PMADs can disrupt that time. But the good news is that they are temporary and they are treatable. And when we think about PMADs originally, women were afraid. The idea of a postpartum depression kind of scared them, because sometimes in the news, you'll see that a woman hurt herself or hurt her babies. But that is only 1%. And those women, most of the time, did not receive treatment, because with PMADs, we know that it's temporary and treatable. And the earlier that you get help, the better it is, no doubt. Next. All right, now, this is a picture of babies doing what they can. And the one in the background that's smiling, that's the one that really warms our heart, but they're a lot of work. And the crying is what they do, and they're adorable. Yes, and we love them all. Next. All right, now types of PMADs. We start off with something called baby blues, and that affects up to about 85% of women. And it's caused by hormonal changes that begin at birth. So think about it. There you are pregnant and you give birth. So as soon as you give birth, now your body begins changing, because the hormones that you needed for pregnancy are no longer necessary. So you kind of move into this next phase, and it does cause a bit of an upheaval for a while. And this baby blues period is thought to be around about 14 days, but we know that 14 days is calling it a little bit of a short time. We really think it lasts at least another week. And the symptoms are crying for no reason, some sleep disturbance, but mostly it's crying about, and as it says, everything and nothing. And baby blues does not require treatment. It rights itself by itself as the hormones settle down and your body is changing. But the good thing is that with support from your partner, from your family, there is a quicker recovery, we think. Now, that's not the same with our perinatal depression and perinatal anxiety. This affects about 20% of women and may be diagnosed before, which is during your pregnancy, or after delivery, and anytime during the first year. And you'll see as we talk about it, that will require some sort of intervention. All right. So just think about those differences. Baby blues, that first couple of weeks, and it writes itself. Moms wake up and say, oh, I'm feeling more like myself. But if it's a depression, that's a whole other thing. And we'll talk about that. Next. All right, risk contributing factors for PMATs. Personal or family history of depression and anxiety. Personal, we're saying that because the mom may have had a depression or anxiety before the pregnancy. And family history, we're always looking at mom. We're looking at her mother, her grandmother, aunts, and they may have had depression and anxiety, so she would be more at risk for that. And history of PMADs, we're talking about the mom maybe with another pregnancy had a postpartum depression and anxiety. So the lack of social support is another risk factor for moms. Social support is so important. The early time of coming home from the hospital with their newborn, there's a lack of confidence that's going on, and the emotional changes. So she needs lots of support. And when I say that, I mean just somebody saying, you're doing a really good job. Look at, you should be so proud of your baby. That's important. But social support can also be that her family lives at a distance and isn't going to be able to see her for maybe a few months or whatever amount of time when she really would like to see them early on. And I know with the pandemic, it's been difficult, but parents and moms have figured it out, with moms asking their family to isolate for a few weeks to make sure that everybody is safe so that they can get to visit. But things have certainly changed. Cut off from family and friends. That's a sad thing, but sometimes that does occur. Another risk is there could be relationship issues. There could be domestic violence, or maybe even that the father of the baby is no longer involved or doesn't want to be involved with the baby. And that certainly is a risk factor for PMADs. Next. Okay. Low self-esteem. This is a really important time for new mothers. When I say low self-esteem, there are moms that, don't think that they're the best this or the best that. So their self-esteem is a little bit low. And going into a pregnancy is probably one of the first times that she really needs to advocate for herself. And when she can't do that, she becomes sad about it. So a lot of moms experience a form of low self-esteem during the pregnancy. And then again, when the baby is born, they certainly need to advocate for themselves again and for the baby. So that's a real risk for the mom. She needs support to help her through those difficult periods, and understand that she needs to be assertive and can learn to be assertive. Stressful life events. That could be a loss of a loved one, maybe someone that she was very close to, maybe passed away during her pregnancy, or maybe she moved to another state, and the adjustment's been very difficult because now she had to find a new doctor, OB, and that can cause a lot of stress, or maybe financial stressors. Or history of childhood sexual abuse and trauma also cause risk factors for PMADs. Adolescent pregnancy. Those young women are experiencing tremendous changes with the pregnancy and birth of a child, and they're more at risk for a postpartum mood disorder. Hormonal shifts, especially during the first 6 weeks and during weaning. Now, the reason for that is, again, because of our hormonal changes. Our progesterone and estrogen that you needed during your pregnancy are now they're decreasing and rapidly, and oxytocin is increasing, which is what we need for lactation. So those changes, sometimes it's an easy change for the body and sometimes it isn't. And during weaning, now a mom could be, let's say that she breastfed for only a month, and then you'll have someone else who breastfed maybe for a year. Either of those women and anyone as they wean, because that oxytocin, which is thought of to be a feel-good hormone, that is decreasing because she is no longer breastfeeding. So those shifts in the hormones create a risk factor. Difficult pregnancy. Many times a woman during her pregnancy will experience health issues, and she may be anxious about that. There may be something that they detected in the baby that they're not sure of. So these things will keep her kind of anxious during the pregnancy, and create, a time or that she's having uncertainty about herself and the baby, and certainly put her more at risk. And traumatic birth. Most women, unless it's a scheduled C-section, are going into the labor room and to have the baby thinking that it's going to be a vaginal birth, but they aren't all vaginal births. So those moms that have an emergency C-section and maybe the baby is in the NICU are going to be more at risk for PMADs. Next. All right, now this is an unusual slide. I had wondered whether I was going to use it or not, but it kind of shows the history here. History was wrong. At one time, we thought that only women could experience a PMADs. We certainly know now that dads can also experience a PMAD. And we're using the uterus because men didn't have uterus, so that's why they thought they couldn't have PMADs. But we know that your uterus is not necessary to have, without a doubt, PMADs. So the ancient Greeks believed that a woman was behaving irrationally, and it was because her uterus was wandering around her body, causing trouble. And I found this, and I don't even remember what study or whatever, but it was recorded 1900 BC, and it was found in an Egyptian text. So when we think about it, a woman's hysteria is a word that means uncontrollable emotion. And hystera is the Greek word for uterus. So that's the connection here. But now we know that dads, without a doubt, can develop a postpartum depression. Next. All right, now fathers and PMADs. Approximately 14%, that's 1 in 7 fathers, will experience a PMAD in the US. And I think those numbers are going to begin to go up as more dads are more involved with the birth of the baby and the care of the baby. And I think we're going to see an increase. Internationally, the number's lower. It's 8.2%. And in Europe and Australia, lower yet, it's 6.4%. And then if we look at overall rates of males with depression, we see 5%. And the number one risk factor here is that their partner has some sort of a mood disorder, no doubt. And up to 1/3 of men whose partners have a PMAD will also have a PMAD. So it's we're seeing more and more studies that are giving us, really good insight that dads will need to be or should be identified early and get the help that they need as well. And here's a couple of more. Father's rate of depression is higher after the birth of the baby than before. And first-time fathers are more prone to depression than dads that have second and third child. So that first-time dad is more at risk for a postpartum mood disorder. Next. All right, so more about dads. Just like moms had hormonal changes, dads have hormonal changes, except they've got different hormones. We have testosterone reducing, and then we have cortisol, estrogen, progesterone, prolactin, and oxytocin. And there's that oxytocin, which is increasing, which is a good thing, because that is thought to be a feel-good hormone. But when we think about dads that might have a depression, the stigma and the shame for them to be asking for help is real. And that dad will hesitate and not get the help that he needs. That's why it's important for us to educate dads and to get them to understand that they are at risk for a number of different reasons, all right? And back in October, we had a dad's conference, and one of our main speakers was Dr. David Levine. Dr. Levine is a pediatrician, and he had postpartum depression. And in his presentation, he told us how it affected himself, his relationship with his wife. She did not have it though, and their infant. And he had difficulty caring for his baby in the beginning. And think about that. He's a pediatrician. And it was hard for him to go near the baby, which we're going to talk about in a couple of minutes. So it was very hard for him. And if you would like to see a presentation by him, he's on YouTube. And his name is Dr. David Levine. And he's a pediatrician, because it's really interesting to see how he dealt with it. And of course, he needed treatment. So he got treatment, and he was treated for quite some time. He even talks about that, and was on medication. But we know that this is treatable and this is temporary. So he went on to have other children. And of course, he was still in his practice, and he was fine after getting the treatment that he needed. Okay, next. All right, now symptoms. Crying and irritable, anger, rage, and irritability. They are probably the most common symptoms that we hear from women. Anger, women talk about having an anger that they couldn't believe that they ever could feel before, and are totally confused about what it even means. So they do know that they need help when they have that, and get the help that they need. Sleeping, not sleeping enough. Moms have difficulty going to sleep, difficulty staying to sleep. And we see that much more than sleeping too much. So those moms, when the baby is even napping during the day, they have trouble just even closing their eyes for like 10 or 15 minutes. Fatigue, low energy, poor concentration, anxiety, and panic attacks. Okay, anxiety, a lot of women will have an anxiety before they are pregnant and before they give birth. So anxiety, they kind of think, well, I'm used to having anxiety. But they do notice that there is a difference. And if they have a PMAD, that anxiety is more intense. And panic attacks. Women that have panic attacks will go for help because they can't bear that. This mom only just a couple of weeks ago was telling me about, she had a baby, that baby at the time was about 6 weeks old. And she had the baby in the food store going grocery shopping. And she felt like she was beginning to have a panic attack. So she said, well, she waited a little bit, but it just kept coming. So she had to leave the groceries and take the baby and go and get into the car. So after we talked about it, she realized that she really needed to get treatment, because you can't bear those panic attacks. They totally disrupt your life. Feeling worthless or guilty, thinking that you're a bad mother. Withdrawal from family and friends. Withdrawal is a form of like isolating themselves. That's one of the things that they do because they don't want anyone to see how they're feeling. They're afraid to be found out, and they're trying to cope with it, thinking that tomorrow they're going to get better. Hopelessness, intrusive thoughts. We're going to talk about that. Thoughts of hurting the baby, theirself, or others. Now that is a very small percent, 1%, and it generally that's a very small percent. So that's not something that moms generally feel. And if you think about the Edinburgh, that's that screening assessment that they give you before you leave the hospital. Number 10 was asking you that. Do you have thoughts of that? So we are assessing for it. Lack of pleasure or interest in the baby, yourself, or others. I want to say that PMADS, anxiety and depression, it actually robs the joy and pleasure of having that baby. You just don't feel the kind of joy that you would normally when you have one of these. So that's why it's important to go as soon as possible to get an assessment and treatment. Next. Okay, intrusive thoughts. All right, I'm going to refer to them as scary thoughts because they certainly are. They scare the daylights out of these moms. And all mothers have some kind of scary thoughts. And just people in general, we have about 60,000 thoughts that fly through our head every single day. And because we are more programmed, unfortunately, for negativity than positive things, scary thoughts fit right into this. So all moms have scary thoughts, and they say things to themselves, or these thoughts are, not that they purposely say it, it just happens. I'm not a good mother. I'm not doing a good job. What if I drop my baby when I'm going down the stairs? Okay. Depression affects parents' ability to parent. Depressed parents are more likely to feel overwhelmed and incompetent, even though they aren't incompetent. Their parenting styles may be withdrawn or hostile and can vary from day to day. Now, you would say, well, you know, this is important because parents and babies need routine, and parenting style needs to be consistent. But depression can affect that. Mothers are less likely to have daily routines or engage in positive activities such as reading or playing with their child. And we hear moms talk about, like, as soon as they're able to, they start reading and talking to their baby. And when you're depressed, it's hard for you to do that. So, and playing with your child. Very soon, the baby is doing the tummy time, and mom is talking to the baby about tummy time as they exercise the muscles in their neck and their arms and things like that. Depressed moms have difficulty doing that. And we found out, without a doubt, we're doing lots of studies with ACEs. I don't know if you've heard the term, but it's about trauma. And maternal depression is an ACE. It's an adverse childhood experience. Next. All right, now we're going to see it's actually a demonstration on how babies are stressed by depressed parents, and that parents not feeling like themselves should really get the help they need as soon as possible. And this only takes about 5 minutes or so, but it's extremely, really, like, I find it unnerving when you see it. We ready?
Babies this young are extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. In this still face experiment, what the mother did was she sits down and she's playing with her baby, who's about a year of age. And she gives a greeting to the baby gives a greeting back to her. This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this. And then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, "Come on, why aren't we doing this?" Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions. They turn away. They feel the stress of it. They actually may lose control of their posture because of the stress that they're experiencing. It's a little like the good, the bad, and the ugly. The good is that normal stuff that goes on, that we all do with our kids. The bad is when something bad happens, but the infant can overcome it. After all, when you stop the still face, the mother and the baby start to play again. The ugly is when you don't give the child any chance to get back to the good. There's no reparation, and they're stuck in that really ugly situation.
Okay, so you can see by that demonstration that a depressed mom just cannot parent that child in the way that she could if she wasn't depressed. So again, I'm going to say the same thing. The earlier that you go for treatment, the better, because this is temporary and this is treatable, and everyone benefits from it. The baby benefits from it, you benefit from it, and the rest of your family, without a doubt, benefits from it. Next. All right, and this is kind of just what I said in different words. The first step towards getting somewhere is to decide that you're not going to stay where you are. And that's an assessment, thinking about how you feel. Even if you were to, let's say, monitor it on the calendar, like rate your day, 1 through 5, and every day, 5 being the best. If you notice that your sadness and your depressed is consistent, then that's the time that you call and get help. Next. All right, now self-care. Now, this is what moms kind of said that they would like when it came to self-care, because it's a big movement on self-care, and so rightfully so, that the better that mom is, the better that she can care for that baby. So a massage. At group today, 2 of the moms at group today said they had scheduled massages for Mother's Day. And they were so excited about doing it. And of course, their partner was going to take care of the baby. Manicure and pedicure. Just get into the bathtub and just soak in the bathtub and relax. Yoga. We have yoga online. So A lot of moms were already saying that that was something that they did, and that really helped them with getting some exercise and stress reduction. Spa day, that's a biggie. Lunch with friends, that's something that is a little hard to do in the beginning, but and with the pandemic, it was a little bit difficult, but that's a wonderful thing. And moms really like getting back to being who they were before they had the baby. Having a night away, shopping, not just online, but they were talking about being able to go into the store and actually do some shopping. Read a self-help book, and brushing my hair. Now, a mom at group last week, we were talking about haircuts, and one mom said, yeah, I got my hair cut and I really like wearing it down, but I don't have time to take care of it. It's an exciting thing for me to be able to even brush my hair. And her hair was up the way that she always wears it, and she loosened it and let it fall down. She said, see how nice it is, and I really feel good when I brush my hair. So that was taking care of herself. So making my bed. Moms don't have time to make the bed. It's low on the list. Sitting outside for about 10 minutes. As the weather gets better, that's a wonderful thing to do, to let the sun kind of just beat on you and just make you feel great. Calling a friend. Friends are really important. To make that phone call, make that connection. I know a lot of people are on Facebook, and that's a great thing. Listening to music also changes our mood, uplifting music. Stretching, doing a little exercise, snuggling with your pet, watching a funny video. And the last one says, not putting myself down. What that means is not criticize yourself for a whole day. And that's really hard to do, but it's certainly something, it's almost like a challenge. If you can do that at the end of the day, you're going to feel 100% better. Next. All right, self-help continued. Make healthy lifestyle choices. Rest as much as you can. In the beginning, it's very difficult, but as the baby gets a little bit older, it is a little bit easier. Taking walks with the baby. Many new moms do that now. They're out there already. The weather's a little iffy, but on a nice day, they do that, and they like the exercise themselves. Eat healthy foods. Now, that's important, but the other thing that's important is not to miss a meal, to have 3 meals a day, and to look at your protein intake. Make sure that you're getting enough protein, because you need all the energy you can get to keep up with your schedule. Drink water, avoid alcohol and other substances. Next. Set realistic expectations. Well, at group a couple of weeks ago, I said, what kind of tips do you have for new moms? Because some of them have babies that are like 7 months old and 5 months old. Well, the first thing that was brought up was realistic expectations. Lower them, lower your expectations, because they all, when they came home with that baby, they felt like I could do anything, I could take care of this, do everything myself, and they realize that they can't. So they cannot, don't pressure yourself to do everything. If it doesn't get done, it will eventually get done, and ask for help. Accept help. Some women that say that they feel guilty if they're accepting help, that they're really, why can't I do it all? But they realize that they can't. Scale back your expectations of having a perfect household. Don't worry about vacuuming every day. You can't do that. The priority is the baby and yourself, and just getting through the day, eating healthy, things like that. And if you hang out in your pajamas and your sweats, that's a great thing too. Just relax, take care of yourself, take care of your baby. And that is good self-help. Next. Avoid isolation. Is talking honestly with your partner. That is important. And with family and friends, choose wisely who you're talking to about your feelings. It's important that you find people that are going to be supportive. And that sometimes is not easy in the beginning. So just find those people, and they're the people that it's important to talk to. Ask other parents about their experience. This is vital information because you can learn tips from other moms that their baby is maybe 7 months old or 5 months old, and you're a new parent. Attend a support group for new mothers and new dads, and we're going to talk about those. We've got support groups that are virtual and free for moms and dads. I'll show you how to get connected. And ask your healthcare provider or us, Central Jersey, about local support groups. Today, one of the moms was telling us that she's been going, she comes to our group regularly, but she also attends what's called Postpartum Support International. It's a PSI, and they have support groups almost every day, and they also have support groups for dads, and they're free. And she enjoys going to them. Next. Okay, support groups. I have moms groups on Tuesday and Thursday at 1 o'clock, and virtual, as I said, and free. And our dads group is on Wednesday evening at 7:30 because dads go back to work early, and 7:30 is a pretty good time for them. Also virtual and free. And all you have to do is just email me. I'll send you the link, and then you can pop on whenever you want. And I think that you'll find great benefit from the support groups. Next. All right, outpatient treatment. And you see the top one is partner support. That's extremely important for your partner to be supportive, for the two of you to work as a team with that new baby, because studies are showing us that with partner support, the symptoms are less intense with PMADs. Education, that you understand about PMADs, understand the dynamic of them, the risks for them, the symptoms, and treatment. Support groups, we talked about that. Psychotherapy. Psychotherapy sounds really like, oh my goodness, what is that? All that is just counseling. And needing a professional counselor is a great idea because they will help you navigate that transition to motherhood. They will help you figure things out. You may have lots of ideas about what you want to do with the baby. They will help you through that transition. Medication, sometimes you might need medication, and that's okay. Complementary therapies. Now, by that I mean things like yoga, which is self-care, Tai Chi, meditation, massage, and some women are using chiropractor, and they find they have benefit from that. All right, next. All right, now this is following up and resources. Next. All right, this is Speak Up When You're Down. This is New Jersey's main hotline and help for perinatal mood disorders. And it's a wonderful program. It's free, and it's for uninsured mothers and those on Medicaid. They provide evaluation and treatment and up to 12 counseling sessions. And the sessions right now are virtual, and they're free. That's the best part. You don't need insurance. All right. But if you do need insurance, you can even call that number, and they'll help you find a counselor, as we would too. The consortium will help you too. Next. All right, now we have something called the phone follow-up program. And the primary goal is to connect at-risk people with support, treatment resources, and other community resources. And community resources can be things like diapers even, It might be that financially you're a little bit stressed, and they can help you find, diapers and other resources, all right? And you can self-refer. All you have to do is call that number, 732-937-5437, extension 179, or send an email. That's Kathy Donaldson. She's our program coordinator, and she will help you navigate the system. Next. Now, this is something that Kathy found, and it's interesting. Find your mantra, and that is find positive things to say to yourself. I'm doing the best that I can. I'll be kind to myself today. I'm a good mother. Just keep saying positive things. And I also talk with moms about, because you get busy and in your routine, and you might forget to say positive things to yourself for a while. Make signs, put signs around the house and say them. When you see the sign, repeat what you see on it. It helps your head instead of negative. Find your tribe. That's your people. Find people that you can relate to. Find people that you can talk with, because all of that's important. Be curious. Look at what you're feeling from different angles. Be honest about it. Think about how you're feeling and evaluate. Do you think that you need to go for professional help? Be kind to yourself, and to find meeting, help other mamas too. Kathy put in just even simple holding the door for a mom that might have a toddler and an infant that she's going into the grocery store with. Okay, next. And keep in mind, if you do have a perinatal mood disorder, it's okay. It's nothing to be ashamed of. You're not alone. It happens to others. You're not to blame. It's not like you woke up one morning and said, I'm going to have a postpartum depression today. You are not to blame. It is something that happens. And with help, you're going to get better. And keep in mind that it's treatable and you're going to get better. Now, questions? Do we have any questions? Next. Okay, do we have anything in the chat box or anything like that?
I'm checking. But again, this concludes our recorded portion of our presentation today. Pat, this was so informative and amazing. And thank you so much to you and to the Central Jersey Family Health Consortium for presenting this topic today to our Ocean County Library patrons. Again, this presentation will be posted up on our social media pages, so keep a lookout for that. And again, thank you, Pat, for everything. This has been—
And thank you for inviting.
Yeah, it's been an honor, and I've learned so much myself.
Good.
For this presentation.
Good.
And so we're going to open it up shortly to questions.
Wonderful.
Let me just give me a few seconds to see here if anything happened here. And again, we thank you for those who are virtually attending for attending this Ocean County Library program.
Support public libraries. Like, share, and subscribe for more great videos.